So as we've been hearing, drug abuse from opioids and heroin is a major public health epidemic in Pennsylvania that has stressed physicians, law enforcement, and local government to the limit. It's a full-blown crisis, not just here in Pennsylvania, but across the country. So what can be done to turn the tide and hopefully bring this problem under control? We're joined by Pennsylvania's top law enforcement officer, Attorney General Josh Shapiro, and the president of the Pennsylvania Medical Society, Dr. Theodore Christopher. Gentlemen, thanks for joining us. Mr. Attorney General, you've been the point man in trying to get more help to first responders in the fight against opioid problems. What can you tell us about all that?
I think it's important for us to just understand the magnitude of the problem. I mean, it's extraordinary. We lost in 2016 over 4,600 Pennsylvanians. That means 13 Pennsylvanians die each and every day from this heroin and opioid epidemic. And it doesn't discriminate. Rural, urban, suburban Pennsylvania, black, white, brown, rich, poor, male, female, everyone is affected and no one is immune. We believe you have to have a multidisciplinary approach to dealing with this. Yes, it's my job to go out and arrest the dealers and punish those who violate the law, and we do that, and we're doing that at an even greater clip than ever before. But we also have to make sure that treatment is available. We have to make sure that there are ways in which the public can engage with us in defeating this crisis. And we have to have an all-hands-on-deck approach. And I'm sure we'll get into some of the specifics, but that's the approach we take day in and day out, multidisciplinary. And I can tell you, of all the work we do, and it's important work that we do in the Office of Attorney General, my top priority is dealing with the heroin and opioid epidemic.
So you were talking about cracking down on drug dealers. What is the state really doing to put more pressure on drug dealers?
Well, we've amped up our efforts to get into the community, to use my Bureau of Narcotics investigators to get out and break up these major heroin rings that are in our communities. We shut down 2 pipelines, for example, that went from New York City through northeastern Pennsylvania out to the York, Altoona, Johnstown area, went that way. That dumped 1.5 million bags of heroin in our communities. We had a massive heroin bust in the city of Philadelphia just the other day. We worked with 18 different municipal police departments in southwestern Pennsylvania, in the Allegheny County area near Pittsburgh, to bust up a major ring there. We're doing that. At the same time, we have increased the number of diversion arrests. That's where a doctor, a nurse, someone else takes pills, legal pills, and diverts them for illegal use, right? They take a Percocet and use them for illegal use. They sell it or give them away. We've increased our diversion arrests there by 50%. So whether it's going after the drug dealers, we're arresting over 3 drug dealers a day on average every single day I've been in office, or a 50% increase in our diversion arrests. We are focused on doing that type of work to make our communities safer and deal with this epidemic. As I said, it's not the be-all, end-all, and it's not the only answer. We need to do a lot of other things, but that's an important part of the work we're doing. Communities
all over Pennsylvania and elsewhere are just overwhelmed by this problem, and they don't have the resources to manage what is happening to them. What can the state do to help?
The state can do a number of things. I was pleased to see Governor Wolf and the legislature appropriate funds for our first responders, for law enforcement, to have Narcan or naloxone, which is going to help people who are dealing with an overdose be revived. Now, the key is, and I hope the legislature and the governor go back and begin working on this, the key is after they're revived, doing a warm handoff, getting them into the treatment they need, or letting us and law enforcement deal with that individual if they're a dealer, if they're violent, what have you. That is going to be particularly helpful from the state. The PDMP, the Prescription Drug Monitoring Program, which has been an important tool for us, I think needs some updating, and I'm pleased that the Pennsylvania Medical Society and others want to work with us in that. I think we all agree that's important. We need the legislature and the governor to work with us in promoting people taking some greater personal responsibility, both for getting into treatment, as we discussed earlier, but also helping get unused medications out of people's homes, their medicine cabinets, their businesses. Now, some of your viewers may be wondering, well, what do these unused medications have to do with the heroin crisis? Well, we know that 80% of heroin users start with a legal prescription drug. They start with illegal prescription drugs. And 70% of them get it from a friend, a relative, or what's laying around in the medicine cabinet. So we've been working with the Medical Society, with district attorneys' offices, with the DAs and others to help dispose of these unused medications. Last year, 2016, We disposed of 26 tons of these unused medications. Think about it. A pill doesn't weigh a whole lot. 26 tons is a lot. This year we're up to 34 tons. But we noticed an issue. In rural Pennsylvania, people don't have access to those drug drop boxes. Sometimes it's an hour away to get there. So in the Office of Attorney General, we've distributed 300,000 of these pouches. They're like Ziploc bags with something that almost feels like a fish tank filter inside. You can dump up to 50 pills in here, pour a little warm water in, zip it up, shake it up, and it deactivates the pills, and then in an environmentally safe way, you can throw it away. So the public can join us in this fight. We've distributed 300,000 of these around the Commonwealth. It'd be great to have the state, increase the number of bags available and get them out. So getting the public involved, making sure treatment's available, updating some of our laws related to, the Good Samaritan law and the warm handoff policy, updating our PDMP laws. All of these things are things the state can do to complement the efforts in the Office of Attorney General.
How can people get one of those disposable bags?
Well, if you go into a pharmacy in one of 17 counties in rural Pennsylvania, you get a Schedule II narcotic, or if you just ask for one, they will give it to you. Home hospice workers also have them because they're oftentimes needing to deal with the disposal of these medications. We've partnered with the Pennsylvania Medical Society. They've been valuable partners in this, in helping us get these out and analyze the data that comes back so we can know where they're most effective and where we need more, perhaps where we need less, although I don't think we'll need less, we'll need a lot more. And so we've had some valuable partners in this effort as well.
Dr. Christopher, what role can the Pennsylvania Medical Society play in combating this problem?
And so doctors have to be laser focused on this, like the Attorney General is himself, and I thank you for doing that, Josh. But I think doctors have to, I believe, totally revamp how they treat pain and just how they prescribe I think prescription pain medication. So, and we're doing that, and we're working on that. It's a long process. It takes 30 seconds to actually prescribe like a narcotic. It takes 30 minutes to actually talk about it and educate the patient. So, education is a major part of this. That you really have to really talk to the patients about what the risks are if you start them on a narcotic. So if you are prescribed 1 day of narcotics, you have a 6% chance, just 1 day, of actually being on that narcotic 1 year later. If you're prescribed it for 5 days, you have a 12% chance of being on that narcotic 1 year later. If you're prescribed a prescription drug, a narcotic for 10 days, you have a 30% chance of being on that drug 1 year later. So it's a major issue, and so doctors have to really decrease their prescribing of these narcotic agents, and it's as we research more alternatives to pain medication, how we treat pain, I think has to change, and we're doing that right now. We're doing a lot of research in that at the major academic medical centers, and so we're looking at ways to treat pain of patients differently, and it's a slow process. So and the problem is, even though the number of the scripts have gone down, the deaths are still going up, and that's because of things like fentanyl and carfentanil, things that are much more, I think, powerful than the heroin by itself. And so we have to really we have to get a handle on this. So that's in the front end is the prescribing, and on the back end, as I think the Attorney General said, is the warm handoffs. And the problem is that if you come into, let's say, an emergency room, that's where I work, and you have an overdose, there is no place there's no easy way for us to get that patient into treatment. And so that has to be outlined, there has to be a process defined, there has to be a way to get these patients easily into treatment. And as I mentioned to the Attorney General, I think in the PDMP, I think one option might be that if you have had an overdose of a narcotic, that gets logged into the PDMP. I think that would be great for all of us to know. And maybe that patient should be, largely, I think, focused to actually go into an addiction treatment at that same time, at that same visit. If you have an overdose now, there's a 10% chance that you'll die if you have just one overdose. And so these are major, I think, issues have to be faced.
I want to come back to something that the doctor said at the beginning, that the emphasis by the Pennsylvania Medical Society and other physician organizations on education is critical for us in this fight. right? We're going out and we're arresting doctors who are, conducting themselves in a criminal manner, right? They're diverting a pill for illegal use. And I know the Medical Society and others want us to do that. But there is this other side of the challenge where doctors are overprescribing, not committing a crime, not doing anything unlawful, but the overprescribing is a contributing factor to this crisis, to this epidemic. And the fact that they've stepped up in the way they have to make education a key component helps us in law enforcement do our jobs, stops people from becoming addicted in the first place, and helps us better deal with this crisis. And so I commend you for doing that, and it's having a positive impact. In the communities where we're seeing the highest amount of concentration of education, we're seeing doctor prescribing practices go down. And that is something that I think should give all of us a little bit of hope. And now as you expand this effort across the state, should have a real positive impact on this.
And the prescribing has gone down, but it's still 3 times what it was in 1999.
Right.
So we still prescribe, I think, way too many medications. So that's we have to keep on going. And the education piece is very important, and that should start, I think, really in high school. And so 33% of all kids, all in high school, athletes, for example, who get started on narcotics, 33%, there's a chance that they will still be misusing these narcotic medications in the future. And so at the high school level, the young kids, young adolescents have to be educated, and doctors in prescribing at that age group.
It's a fantastic point. We created a new Office of Public Engagement in the Attorney General's office where we go out, we educate, we inform. We think that's a good way to have crimes be stopped in their tracks. And we are finding in the high schools and even in the middle schools the need to have far greater education about the dangers of prescription drugs. You go ask a 5th grader, is it okay to use heroin? They'll say no. Right? It's an illegal drug. There's needles involved. It's scary. But if you ask them, is it okay to take a pill from mom or dad's medicine cabinet? Is it okay to use something that comes in a prescription drug, vial? They don't universally know how dangerous that is the way they do heroin. And so it's important that we educate them. Having the Medical Society involved in that effort is really critical. And it's part of the outreach and education efforts that are ongoing in the Attorney General's office.
You're one of several states' attorneys general around the country who are taking an active role in investigating major pharmaceutical manufacturers for their role in creating the opioid problem. Where does that investigation stand?
41 state attorneys general have come together to investigate pharmaceutical manufacturers and distributors, those who manufacture and distribute opioids. Pennsylvania is one of the lead states in that massive multi-state investigation. I'm not at liberty to talk at great detail about the investigation, but what I can tell you is we're targeting 5 opioid manufacturers and 3 opioid distributors, including the 3 that were named in that 60 Minutes piece, which many people saw recently. We will get to the bottom of it. We will hold them accountable. We will change corporate behavior so they can no longer turn a blind eye to facts and science. They can no longer turn a blind eye to a rural pharmacy that was getting 1,000 OxyContins one month that jumped to 50,000 the next month and nobody asked any questions. And we're going to make sure that we recover for the Commonwealth of Pennsylvania, counties, cities, and others who have been impacted by this. There is, as I said, a need to deal with this crisis in a multidisciplinary way, and the pharmaceutical companies have a major role to play in this crisis, and we are going to hold them accountable.
Dr. Christopher, you said that despite the fact that the numbers are down, it's still 3 times higher than it was in 1999. That's a stunning statistic. What's happened since 1999 to get us to this point?
Well, I think one of the things is that CMS, as the government, had a laser focus on how doctors and how providers treat pain. And so pain was actually, it's a graded, I think, it's a graded response. Patients are allowed to grade us in doctors how we treat their pain. And so with that, the grading of the pain scales came incentives at both the hospital and the doctor level. So doctors are actually incentivized to treat pain to a 0 level. And so doctors, the best way to treat pain is I believe, with a narcotic. To totally get your pain scale down to 0. And so now I think the thinking is that pain isn't all bad. Having some pain is not a bad thing. It's actually biological. And so the goal should not be to totally 100% rid of your pain, but to alleviate your pain. So, but doctors were laser focused on treating pain with narcotics, and so that's what happened. So you'll see a huge jump in like 2000 as to the amount of prescriptions for narcotics that doctors wrote, and so that's all been scaled back, and so the government has scaled that back until pain scores and pain scales are now off of patient satisfaction surveys in the hospitals and in physician practices. So that's a good thing.
So we have just a couple of minutes left, but I want to ask you both. What should the citizens of Pennsylvania do if they suspect drug abuse in their own family? What resources are available to help?
Well, there are resources in the counties, centers of excellence where people can get treatment. There are a multitude of different services county by county. Certainly, if you can't access them, you're unaware of them, you can contact the Attorney General's office and we can make that connection for you. We do need to make sure that we have greater access to treatment in Pennsylvania. I think right now it's very hard for people to find beds for treatment. And one of the key sticking points we've seen is that many people who need to access drug and alcohol treatment can't afford to pay for it themselves. The Commonwealth can't afford to pay for it, and counties can't afford to pay for it. And so oftentimes they'll need to tap into Medicaid resources to cover those costs. Well, there's this ridiculous federal law from the 1960s. It's called the IMD exclusion. And it says that if you're going to go get drug and alcohol treatment or mental health treatment, but for these purposes, drug and alcohol treatment's the subject of your question, Medicaid will not reimburse for a facility that has more than 16 beds in it, 1/6. And so that takes a whole bunch of these treatment beds out of the equation because Medicaid can't reimburse for it. I've organized a national effort working together with my colleague in Ohio, the Attorney General there, to get us to work in a bipartisan way with Congress to lift the IMD exclusion and open up all of these other beds to make them available to Pennsylvanians to get access to treatment. Treatment is key. Removing that IMD exclusion will open up a whole lot more beds and open up more funding streams to make it available for Pennsylvanians.
I'll just say one thing to that. So in Philadelphia, I'm told there's 1,000 beds that are not being used. They're variable for the patients. And the reason is because the patients don't know about it, number one. And two, because doctors don't know how to get the patients into these beds. And so even though the process is not there. So I think the warm handoff, I think, is very important. But just how, in actuality, that you get a patient who presents, let's say, into a hospital or emergency department or a clinic into one of these beds, that process has to be shored up.
Yeah, 10 seconds on that. It takes doctors a nanosecond to prescribe 60 days worth of Percocet or OxyContin. It'll take them half a day in their office to jump through hoops with insurance companies to get someone into treatment. We issued a 10-point challenge to insurance companies all across Pennsylvania to both reduce the reliance on prescribing and increase the access to treatment. Many of them, IBC, Highmark, others, UPMC, have stepped up to try and help in those efforts. We need everybody to do that. I'm going to continue to challenge insurance companies to make that available.
And I'm afraid we're out of time, so that's going to have to be the last word on this subject. But I want to thank you both, Josh Shapiro, the Attorney General of Pennsylvania, and Dr. Theodore Christopher from the Pennsylvania Medical Society. Good luck to both of you in what I think everyone agrees is a very tough fight against drug abuse in Pennsylvania.
Thank you.
My pleasure.
And thanks to you for joining us for this edition of Harrisburg House Calls. Remember, you can see a complete rebroadcast of this program on the PCN website by clicking on the Sunday Fusion link at pcntv.com. You can also find this show at the Pennsylvania Medical Society website, where you can find lots of useful information on the opioid epidemic, treatment options, and what's being done to address this problem in Harrisburg. And please join the conversation in social media. Like us on Facebook or follow us on Twitter at PA Med Society. We'd love to hear from you. Until then, I'm Bob Oltmanns. Thanks for joining us.